Good afternoon and welcome to the Princeton Public Library. Thank you very much for joining us for this presentation on health insurance options and accessing healthcare coverage. A few logistics before we begin. This webinar is being recorded and will be available following the presentation on the library's YouTube page. During the presentation, we invite and encourage you to submit questions at the bottom of the screen using the Q&A button, and we will answer any of those following the main presentation. We're very pleased to have the Family Resource Network here with us today for this presentation. The network is a statewide organization that provides community-based programs and services to individuals and families with a variety of disabilities and chronic conditions. Its Navigator program is dedicated to helping consumers learn about affordable healthcare options and how to obtain benefits. Our presenter, Renata Svincicka, is the Community Health Manager at the Family Resource Network, where she oversees the Navigator program and manages day-to-day operations of the Health Innovations team. So welcome, Renata. We're very pleased to have you back.
Thank you so much, Nora. Thank you for the wonderful introduction. And I am so pleased to be here today. Today's presentation is Coverage to Care. Now that the open enrollment is sort of over for most people, they were able to sign up during the regular open enrollment period. So they now have coverage and they may have questions on how to use their coverage and where to get help. So this is what I'm going to be discussing today, how to make the most out of your health insurance policy. So let's begin. So what is Coverage to Care? Short for C2C, it aims to help individuals understand their health coverage and connect to primary care and the preventative services that are right for them so they can live a long and healthy life. This definition was taken from the Center of Medicare and Medicaid Services, and I just think that it is the perfect description on what your coverage actually is supposed to do. It's supposed to help you in case of an emergency, and it's supposed to prevent you from having any illness and making the most out of your appointments, asking the right questions, getting the right help, and this will ensure that you live a good and healthy life. So what are the 5 ways to make the most out of your health coverage? So the 5 steps, we think that it's once you actually sign up during open enrollment, the first step is to confirm your coverage. Second is know where to get help. Third, locating providers. Fourth, scheduling appointments. And fifth, follow your plan of care. And now I'm going to discuss each step individually. So the first one, confirm your coverage. So after you select your plan, after you go through your entire application on the Get Covered New Jersey marketplace, you have to make sure that you pay your first monthly premium to activate your policy. Just selecting a plan, unfortunately, is not enough. You do have to contact your insurance provider and you have to make your first payment. Because if you do not do that, unfortunately, you would not be able to use your health insurance. And a lot of times the Get Covered New Jersey marketplace will ask you to submit any supporting documents, whether it's to prove your income, your immigration status. If you moved, they may ask for proof of address, some sort of confirmation from your employer if you were let go or you got a new job, and to show your new income change. Any of that can be requested by the Get Covered New Jersey marketplace. And so they usually give a deadline to submit those supporting documents. And so you absolutely have to make sure that you either submit it online or by mail. And, this will ensure that your health insurance will continue. The second step is know where to get help. And you have to contact your health plan provider to find out cost and coverage information. This way, you can kind of avoid getting any surprise bills, and you kind of know what your coverage actually provides. And I'm going to get to this a little bit later on in more detail, how to actually read the cost and coverage information. But you can also contact your health plan to do that if you just absolutely do not understand it yourself, which is perfectly fine. Health coverage tends to get a little bit confusing. And then you can also contact a certified health insurance navigator for assistance with contacting your health plan or understanding your benefits. Certified health insurance navigators, such as myself, we provide assistance with not only health insurance enrollment, but also understanding your health insurance plans. The next step is to locate providers. If you're brand new to your health insurance policy, you can contact your health plan via phone or online on the website to find out in-network providers in your area. If you had a doctor before, you do have to double check to make sure that the plan that you selected, your doctor will take the plan that you selected. And again, you can contact a certified health insurance navigator for assistance with locating providers. We can do that for you. Scheduling appointments. When making an initial appointment, you have to confirm your provider accept your health insurance plan, such as I just stated this before. And you have to discuss preventative services with your new provider and any concerns you have. So we always suggest making a list of questions when you go for your first appointment with your new provider. Bring up any concerns that you have. Your provider will probably send you for some follow-up testings, and based on that, they will write up a plan of care. So those screenings can be blood work, radiology, mammogram. And again, we always encourage people to follow the steps exactly how the doctor suggests. They may send you for blood work first, and then maybe an MRI. And, we do encourage people to always complete those screenings from A to Z. And once your doctor gives you your plan of care, you do have to make sure that you follow it. This will ensure that you get the best outcome from your from the standpoint of your health. The doctor will determine everything based on your visit and your test results, and may give you any prescriptions, and make sure that you always fill your prescriptions that you need to take. And roadmap to better health. There are 8 steps to, again, make sure that you get the best health and live a healthy life. So here's a little visual that, again, was pulled from the CMS, the Center for Medicaid and Medicare. And again, I'm going to walk through the steps individually. On this visual, it includes 7 steps, and there's going to be an 8th bonus step at the end. So I will discuss that right now. So the first one is you have to put your health first. We always like to give this analogy when you're in an airplane. They always suggest that you put the oxygen mask on yourself, and then you can assist your child or your spouse or your loved one or your friend, whoever you're traveling with. So, you cannot care for others. You cannot, really operate as a human if you don't take care of yourself. So get your regular checkups, follow a healthy lifestyle, eat a nutritious follow a nutritious diet. We do share that many screenings come at no cost. And if you get any medical records, keep those copies so that if you change your health plan and you have to see a new doctor, they will know exactly what your medical history is. The second step is to understand your health insurance plan. And in order to do that, you have to understand your co-payments, your deductibles, your co-insurance, and maximum out-of-pocket, again, to avoid any surprise bills. Unfortunately, many health insurance plans, they do come with deductibles and maximum out-of-pocket. And if a person doesn't understand that, they may think that since they're paying their monthly premiums, then everything is covered. But unfortunately, in most cases, that's not the case. You do have to meet your deductible. And if you're not expecting those bills, then it can be a little bit of a burden. And you have to understand the difference between in-network, out-of-network providers and tier 1 and tier 2 providers. I will get to this a little bit further down this presentation. And you have to look into your plan to familiarize yourself on what is covered by your health insurance plan. Again, not everything is covered. Some plans, they do cover rehab, some don't. They have different coverage levels. So once you sign up, or before even you sign up, in order for you to make the right decision, look into that. And if you need help with reading that information, you can absolutely get help from navigators such as myself. Know where to go for help. For regular or sick visits, we suggest that you call your primary care provider, your PCP. Outside of your PCP's regular business hours, you may visit a walk-in clinic if anything is bothering you and you cannot wait until, say, this happens on a Friday night and your PCP is not working on weekends, but you have this terrible headache. You, of course, may go to a walk-in clinic to see what is happening and then follow up with your PCP. And then in case of a life-threatening emergency, you can go to your nearest hospital. We do suggest those steps because this will ensure that you are not overpaying for your visits. If you get a headache and go straight to the hospital, to your emergency room, it may tend to come with a high bill. So there's really ways around this, and you can probably get the same help from a walk-in clinic, and it's going to cost significantly less to do that. So finding a provider. All health insurance plans provide a list of providers on their website. You can also contact your provider, health insurance provider, by phone, and they should be able to tell you what doctors are available in your area. Some plans, they do assign a provider automatically if you do not select one when you sign up for health insurance, which is totally fine. It's not, it doesn't mean that you're going to have to stay with this provider. This is just the health insurance's way to make sure that there is somebody assigned to you, but you can absolutely change your doctor for any reason at any time. You just have to contact your insurance company to do that. Making an appointment. If you are a new patient, you will be asked to provide your personal and your health insurance information when you make an appointment. You do have to verify that the provider accepts your insurance and that they are an in-network provider. If you did not do that before, if you didn't check on your health insurance plan's website or didn't call them, you can also call the doctor's office and ask them, and they should be able to tell you to confirm. And you have to request a day and time that works for you. That is also totally fine to do that. You know, you do not have to go with just the first time and day that they give you. You can also request something that works better for you. But of course, if it's not available, the doctor will let you know. And you have to be prepared for your visit. This means that you need to have your insurance card and your ID with you when you go. We, again, always encourage our consumers to know their family medical history. You can ask your family about any chronic illness or any issues that they have, because as we all know, medical history tends to kind of affect our health. And so, you know, it's always good to know that, and make a list of medications that you take if it's applicable to you. And as I mentioned before, bring a list of questions you'd like to ask your provider. And it's also totally fine to take notes because you tend to get a lot of information during the doctor's visit. So taking notes kind of helps you to remember everything. And when you go home, you can go over the notes and again, make sure that you didn't miss anything and you understood everything properly. And if you need assistance during your visit, you may bring a chaperone, or you can also request one. Not many people know that, but you can call your doctor's office. And if, say, you need assistance with getting from the car to the office, the doctor's office is supposed to provide you with that assistance. The guidelines may be a little bit different now during the pandemic, but still the doctors should consider that, and many of the doctors, they still provide such service. And you can decide if the provider is right for you. So if you see a new doctor, you have to ask yourself if you feel comfortable with this doctor. Did he or she address all of the questions that you had and met your needs? And it is perfectly fine to change your provider at any time if you're not happy with them. And if you want to do that, you can return to step 4, which is locating a provider. And then the bonus step, the 8th step, is next steps after your appointment. So I am repeating myself during this presentation, but follow your provider's plan of care. We cannot stress this enough that you know, doctors, they give you a prescription for a reason, or they want you to see other specialists, or do some kind of screenings. There's always a reason for that. So please make sure that you follow that plan of care. Fill your prescriptions and take them as directed. Many prescriptions, such as seizure medication, for example, they do have to be taken as directed, because if you miss a dose, unfortunately, you may have a seizure. So it's very important to remember to take your medication. Schedule follow-up visits if applicable. Say your doctor suggested that, or well, once you did all of your tests, they wrote your plan of care and they said that they want to see you in 6 months or 12 months. Please make sure to remember to make those follow-up appointments. Do not go too long without seeing your doctor again. And once this is all done, your insurance company will receive a bill from your doctor. And by law, your insurance company is required to send you an explanation of benefits, commonly known as EOB. And this piece of paper will state exactly what the doctor billed your insurance company and what the insurance company reimbursed the doctor. And it usually lists the amount that you will have to pay if it applies to your insurance. So this kind of gives you the heads up before you get your doctor's bill. You can prepare for that, and you can expect to receive the bill for that specific amount. And understanding your health insurance plan. So now I will be discussing copays and deductibles in more detail. And hopefully this will help you understand how the health insurance plans are set up. So what is a deductible? The deductible typically applies for most commercial private insurance plans. And this is the amount that you pay for covered healthcare services before your insurance plan starts to pay. So for example, your deductible is $2,500. So although you purchase your plan and, for example, you pay $150 a month, but on top of that, you also have a $2,500 deductible. So that means that you have to meet that deductible before your insurance plan starts to pay. So this means that, say you purchased your plan, you made your appointment, you saw your doctor, they gave you referrals for blood work and some other screening. So when you complete all of those tests, obviously you get a bill for those. And so you will have to pay those bills until that those bills in sum, they will reach 2,500, and then your health insurance plan starts to pay. What is out-of-pocket maximum? And deductibles are always confused with the out-of-pocket maximum. So this is the most that you'll ever spend out of pocket in a given calendar year. So I always like to give this example. If, for example, your out-of-pocket maximum is, say, $6,000, then this means that even if you end up in the hospital, God forbid something happens, you break a leg, and after your hospital stay for, say, a week, you get a bill of $100,000. I'm making up numbers, but your maximum out of pocket will tell you the maximum amount that you will have to pay for that hospital stay. And once you reach that out-of-pocket maximum, your health insurance will not bill you anymore. So basically, the health insurance will cover the rest of that bill. And if you have any follow-up bills, the health insurance will continue to cover them in one calendar year. What is a copay? A copayment or a copay, it is a fixed amount for a covered service. It is paid by a patient to the provider of service before receiving the service. So, for example, your specialist copay is $50. So that means every time that you see an ENT, for example, ear, nose, and throat doctor, you will pay $50 for each visit. And in most cases, this is also an important piece of information. Copays do not count towards deductible. So any screenings, your medication that you pay for will count towards deductibles, but copays will not. So tier 1 versus tier 2 providers. Again, many health insurance companies, they do like to utilize tiers. There's typically 2 of them. So tier 1 means you will pay a lower copayment or coinsurance, and tier 2 is always higher copayments and coinsurance. If a doctor is in tier 1, that means they have a certain contract with your insurance company, and that means for you that you will pay a lower copayment or co-insurance. On the flip side, tier 2 means higher everything. What is an in-network provider? So there's in-network and out-of-network. In-network refers to a healthcare provider that has a contract with your health insurance plan to provide healthcare services to its plan members at a pre-negotiated rate. Because of this relationship, you pay a lower cost sharing when you receive services from an in-network doctor. For example, your health insurance company, they do not utilize tiers. They just strictly do in-network, out-of-network. And so you have to make sure that you stick with in-network providers to make sure that your insurance company pays for your visits. Because if you use an out-of-network, they will not do that. What is a drug formulary? This is usually provided, well, not usually, but most of the time provided to you when you sign up for a health insurance plan. This is a medication formulary, a list of generic and brand name prescriptions, drugs covered by your health plan. So different health plans, they cover different medications and they cover it at a different level, and the medication formulary helps you understand what the coverage is for your specific health plan. And local help. So certified health insurance navigators, they are trained to provide assistance with health insurance enrollment and answering any questions, providing guidance to individuals with their health insurance. And FRN navigators that I represent, we again can help you understand your health insurance benefits. Our navigators speak English, Spanish, Russian, Lithuanian, and more. And our services come at no cost. Again, we're a nonprofit organization. We are state funded. This program has been put into place by the governor. And so there's absolutely no cost to use our services. And this is our contact information. So our phone number is 1-800-355-0271. Again, it's 1-800-355-0271. Our email address is frnavigator@familyresourcenetwork.org. And our website is www.frnavigator.org. So you can contact us at anytime through those channels, and we would be happy to assist you and look at your case individually. And either if you need help enrolling, or you already have a plan and you need to, say, find a doctor or understand your health insurance plan, we will absolutely help you to do that. We provide assistance outside of regular business hours. We do have evening and weekend appointments by request. And yeah, like I already mentioned, we speak different languages. We try to be as flexible as possible. Oh, and obviously right now we're not able to provide any in-person appointments, so all of the appointments are virtual. This means that we're able to assist anyone in the state of New Jersey in all 21 counties through phone, through Zoom, Skype, FaceTime. Again, we try to be as flexible as possible. Whatever works for you, we will try to accommodate you. And if anybody has any questions, feel free to ask me now. You can either unmute yourself or post it in the chat box. I do see that there's something in the chat box, so let me. Okay, so that was Nora encouraging everyone asking questions in the chat box.
Thank you, Renata. This is very helpful, I think, for a lot of people they find that they either assume they understand what terms mean without maybe having ever needed to use them before, and so then find surprises when they do, need to seek additional medical assistance or something. Or people know that they don't know what these terms are or what their coverage means, but maybe are nervous or they feel ashamed to have to ask, as if they should just immediately understand everything that
Yeah.
health insurance. Well, we know it's such a complicated topic.
Absolutely is, and it changes all the time. Even us as navigators, we do have to recertify every year, and there's always new stuff that comes out in the training that we sometimes, I'll be brutally honest, have a hard time understanding. So I cannot imagine, regular people that have to deal with this. It is confusing, and it is totally fine to ask for help. We're there to help.
Absolutely. So I'm glad that we were able to kind of go over, especially some of those terms, and for people to know that this program exists that can kind of walk them through all those steps.
Yep.
I was wondering, I know even for people who maybe have had maybe the same insurance for a while, but maybe haven't needed to really use much of it. They're not they're not needing a lot of
Yeah.
of doctors or something. When you do you ever get kind of the same question over and over again from people who maybe need to, use more of their health insurance that people are either surprised about, or maybe there's like a most common question that you guys get?
Yeah, so we definitely tend to get the specific question when it comes to insurance from people who have had insurance for, or in case of an emergency, say, they purchased it and they kept paying their premiums, but they never actually had to use it. They never had time to go to the doctor, and they just kind of kept it in case that they end up in the hospital. And then something happened, they suddenly have to see a doctor or a specialist, and they don't tend to understand the deductibles. So that is the common misconception that, people think that if you purchase a plan and you pay your premium, that automatically everything is covered, but then they get a bill and they're like, oh, well, what's this? So we have to explain to them that they have to meet a deductible, which is mostly the case for private plans. Only like certain gold level plans, they don't have a deductible, but there's super rare. Most plans, they do have a deductible.
I believe those are all the questions we have at the moment, but if there are follow-ups from anyone who is viewing this recording after the fact, please do reach out to Renata and her team at the Family Resource Network with any additional questions about your own existing coverage, or if you're looking to get new coverage and you have questions about navigating that process. They are the Navigators, as it's called, and they're ready to assist. I did also just want to point out that something earlier Renata had mentioned, needing a lot of paperwork, wanting to keep copies of documents. And if you are a Princeton Library community member, not even a library member, but you are certainly welcome to always come and use our technology if you need to scan materials, if you need to print or make copies of any documents. We have those services available, so we encourage you to please use those if needed. Renata, thank you again so much for this presentation. Any closing thoughts before we say farewell?
No, I don't think so. Thank you so much for having me today.
Perfect. Thank you. Thank you again.
All right. I hope you have a good day, and thank you for everyone who's going to view this presentation.
Thank you.
Bye-bye.